Hi, I'm Dr. Elizabeth Coyne, and I'm here today with Anjali. She's a registered nurse and advanced practice nurse from Sri Lanka, who also is an educator in her country. And she's come to Australia to do her PhD looking at the role of advanced practice nurses and their challenges that they may face. And one of the things that we know when we're looking at the health system is there has been a change in roles. There's been a development of advanced practice nurse role. And this has been cause of the changes in the delivery of healthcare. When we think about our patients now, they're often very short stay, very complex, much higher acuity while you as a nurse are looking after them. There's also an increased cost factor with health professionals and delivery of health education and health care to patients. And so our health system has looked at ways to actually reduce that cost, and having advanced practice nurses actually provides a great opportunity to have each care provided at a cheaper cost. There's also an increased expectation for clients that they have a nurse that knows them, that can provide tailored care, to follow up with them, and also to be there through their journey in the health system. We also know there's been changes in diseases and the care required. A lot of diseases now have got a greater survival period. The complex treatments often managed at home by the patient and the family. And so this is all something that often then, as the advanced practice nurse, you are dealing with. And so one of the things that we can look at is that we know that the advanced practice nurse is often either assigned a patient load, if they may be like the specialist wound care nurse or diabetes nurse, or they may be actually using a case study load approach. But they have a specific scope of practice, which, although identified by themselves, may be challenged by other health professionals or by the patients themselves. When you have the opportunity for case study, this also means this follow-up, and you do get to know your patients really well, which can be positive, but also has negative. The other thing that we identify with advanced practice nurses is that they can provide very innovative care. They can actually look at what's needed and look at ways to deliver that care well and to the best way for the patient and family outcomes. Now, Anjali, in your work with advanced practice nurses, what do you see are some of the challenges that they face when they're dealing with a caseload of patients?
I think the main challenge that they are facing is the stress and burnout with the huge number of caseloads that they are assigned for. So I think just having for a moment for self-care is important step to improve their stress and burnout.
So one of the things that you've talked about in self-care, so do you think that this is something that they should just really integrate themselves?
Yes, I think the physical and mental well-being is the most important aspect, as well as having a self-care is important, because then they can, when they are physically and mentally overwhelmed, their well-being is all right. So then their care that they are providing the quality is high. So then that's why.
So what you're saying there is, if the nurse actually looks after herself, the care she provides is better.
Yeah, exactly.
And have you found there's many hospitals which are sort of looking at this approach and recognising the challenges these nurses face?
Yes, I think so. There are so many research that are conducting on regarding this issue, and so many interventions have been conducted.
So if you're an advanced practice nurse and you're sort of wondering what the research is out there, what sort of self-care, what sort of ideas that you may be able to use in your practice, there is research there then?
Yeah, there are so many researches have been conducted regarding the self-care practices. So just as an example, I can say just having a little moment while you are working, just to think about yourself, the positive emotions, especially gratitude, those things will provide you a relaxation. So it will help you to reduce your stress and prevent the burnout.
Sometimes people talk about sort of different methods of coping. Are there ways that the nurse might sort of identify what they're using for coping?
Yes, I think, yes, there are so many online courses and apps have been developed that they can use. So many informations in the online and internet.
Sometimes we sort of suggest journaling, or even just that reflection at the end of the day of how the day's gone.
Yeah, exactly. That is a good approach. So if you can write or reflect on your activities that you have been conducted so far, so then it will help you to relax your feelings and stressed feeling. So it's a good approach actually.
Yeah, and it's really important to actually sort of talk with your colleagues, isn't it? And check that they're okay and sort of reflect yourself.
Yeah, actually that's also very good, very important aspect. The communication always plays an important role when we are talking about the stress or burnout. So I think have a good team. Actually, this is the teamwork. So having a good team will always help you to reduce your stress.
Thank you. That was excellent. Thank you.